Hello, Dr. Mashburn again. And so we're going to end our skin discussion talking about skin disorders. Whenever we talk about an organ or an organ system, I like to talk about the normal, but I also like to mention some abnormal. I think a great way to learn what's normal is to recognize what's abnormal. So if you know what's not right, then that'll let you know what is right. So we're going to talk about a couple of skin disorders. The other reason I do this is I get a lot of questions about it. So as we're talking about skin, someone always raises their hand and says, hey, I've got this thing, or what about this, or what about that? So I'm just going to put in a couple of common things so that hopefully if you've ever seen this or you have a question about it, it'll answer those questions about some skin problems. So the first skin disorder is skin cancer. This is very common and I get a lot of questions about it. So when we talk about skin cancer, most of these tumors are benign. Okay, that means they do not metastasize or they do not spread. Okay, they're localized and they can be dealt with fairly easily. Okay, and so they're not a big deal. I mean, you need to be careful and you need to take care of them, but most of them don't cause you a lot of problems. Some of them are very dangerous, and we'll talk about those. Now, what gives us skin cancer? One of the main risk factors is overexposure to UV radiation, so sunlight. So what do I tell you to do? Wear sunscreen, okay? Wear a hat, wear a long sleeve shirt. So too much sunlight can increase your risk for sun cancer or skin cancer. Also, the lighter your skin, the higher your risk, okay? So remember, melanin helps kind of cover that DNA. So the lighter your skin, especially light hair, light eye color, increases your risk for skin cancer when you're exposed to sunlight. Also, frequent irritation to the skin. So some people who work in industries where they're exposed to a lot of chemical solvents, maybe their skin's real irritated all the time, that can also cause your skin to become cancerous. Now, there's multiple ways to deal with skin cancers. You can do surgery, you can do chemotherapy, radiation therapy. There's different depending on what kind of cancer. There's also some lotions out there. There's something called Aldera that you can actually use if you have early forms of skin cancer that can actually reverse the damage and cause the skin cancer to go away. So again, don't freak out if you get diagnosed with skin cancer. You can be treated. Again, unless it's melanoma, that's the worst one. And I'll talk about that in just a second. So when we talk about skin cancer, it's usually a certain skin cell type that kind of goes wacko. It proliferates. It goes so it's growing so much and overproducing and undergoing a lot of mitosis that you get this type of cancer. And so the first one is a basal cell carcinoma. Okay, so the name tells you something. It's that bottom layer, that stratum basale. It's those cells that undergo mitosis that make the epidermis. They're proliferating really rapidly. And these cells will start to proliferate, and they'll actually start to invade down into the dermis and hypodermis. And I've got a picture. A lot of times they're going to be kind of a round, kind of a pinky color. They're not very malignant. They're the least malignant of the cancers, and they're the most common. And 99% of the time, they'll just go cut it off. They may even freeze it off, but they'll just take a knife or maybe freeze it and get rid of it, and that usually takes care of it. Okay, so if you can catch it early, if you start to see changes in your skin, make sure you're looking in the mirror and looking for changes. And if you can't see parts of your body, get your partner to check. You always want to check and make sure that something on your body is not changing, because if skin starts to change in color and shape and form, that's a warning sign that it's becoming a carcinoma, either a basal cell, we're going to talk about squamous cell, we're going to talk about melanoma. So always be aware of small changes in your skin. Now, another type is squamous cell. Okay, so this is the keratinocytes of the stratum spinosum. So squamous, remember, flat. And so this is the second most common. And this is what a squamous cell looks like. Usually kind of has a rough appearance, not as smooth as the basal cell. Real common on areas that get a lot of sun, like the scalp. So if you've got thinning hair, especially bald, you may see it on your scalp, your ears, especially guys. They always wear a ball cap, but their ears stick out. So a lot of times you'll see it on their ears. The lower lip and the hands. Again, not very malignant. It's kind of the second most common, but it's not very dangerous. It has a really good prognosis if you use surgery and radiation. But again, you need to catch it early. All of these, the benefit of knowing about skin cancer is to catch it early. The earlier you catch it, the better your prognosis. And also, the smaller it is, the smaller of the excision place, so the less likely of scarring and damage, permanent damage. So the smaller you find the cancer and the quicker you get it removed, the better off you are. So always, again, pay attention to your skin. Then the last one's the melanocytes, the melanoma. So melanoma, it comes from the melanocytes that have started to proliferate. And melanoma is highly metastatic. That means it spreads quickly. So it starts to proliferate, it starts to break away and get into the lymphatics and the bloodstream. It can go all over your body, it can go to the brain, and it actually can be lethal. So melanoma is the most dangerous. And it's also the hardest to deal with. It's very resistant to chemotherapy. The common way to deal with melanoma is just a large surgical excision. And so they'll also maybe even add some immunotherapy. So if you have a melanoma that's about that big, the excision site, they're going to go about 3 times the size of that site and then twice as deep. So it's going to be a really large area that they remove because they want to get all the borders. They don't want to have any borders. You don't want to cut into the melanoma and allow it to escape and metastasize. So it's usually going to be a very large surgery, very large excision area, and a pretty bad scar. So how do you know if you have melanoma? When we talk about melanoma, we use something called the ABCDE rule. Okay, and so when you see something changing on your skin, think ABCDE, and that will maybe give you an indication of, okay, it's maybe squamous, maybe basal, but maybe melanoma. If it hits 4 of these 5 characteristics, you need to be going to the doctor and getting it checked out. The first thing, the A, stands for asymmetry, so the 2 sides don't match. So remember that basal is that round, kind of was just a round mole-looking thing? So in this one, you can see it's not symmetrical. You can't cut it in half and it match on both sides. Okay, so asymmetry. Border, it's not going to be smooth. It's going to be jagged. It's going to have indentations, so a rough border, not a smooth border. The color, it's going to have a really different color than your skin, not going to be that pink color. It's going to be dark, brown, black, tan, maybe blue or red, and many times multi. It's got all of these colors. So you can see this one. There's some red here and some black and some brown. So look for different colorations. Diameter, how big is it? If it's larger than a pencil eraser, you need to be concerned. Okay, so if something's growing rapidly, larger than a pencil eraser, again, be concerned diameter. And then E, it depends on the textbook and depends on what you've learned. It can stand for elevation or evolving. So is it raised? And just because a mole is raised doesn't mean it's melanoma. So I don't like people to go, oh, it's a raised mole, I should freak out, because not always. Evolving is really more important. Is it changing pretty quickly? So if you've got something that's asymmetrical with jagged borders, multiple colors, large diameter, and changing, then you need to be thinking melanoma and get to the doctor. It may also be itching because the cells are mitosing rapidly. They can cause some discomfort and an itching sensation. So you want to get that checked out as quick as possible. Now acne, really common, especially in our college students. We all know what acne is, whiteheads and blackheads. And so this is due to overactive sebaceous glands. You've learned about those oil glands, and these are going to kick in adolescence, and they stay with you for a long time. They don't really start to slow down until, late adulthood. So you're going to grow out of your acne to some extent, but it's going to stay with you in your 40s and 50s before it's completely gone. And what happens is the pores become blocked and bacteria can grow in there. So those sebaceous glands, that oily fat, it's just a great place for bacteria to stay and live and try to eat up that fat, and they block the pores. And if cells come in, white blood cells come in to the area to try to fight off that bacteria because you've got inflammation, we call that a whitehead. That's the ones you pop and the pus comes out. If there's no white blood cells, it's just a blocked pore, we call it a blackhead. Okay? And then, of course, treatment. Clean your face. Wash your face. If you have severe pimples, a lot of whiteheads, you may need antibiotics to get rid of those bacteria. And you may need some creams to try to slow down those sebaceous glands and dry those out. Okay? So that's acne. Again, it usually picks up, somewhere in your adolescence, and it continues 20s, 30s, 40s, and then 40s, 50s, 60s, it starts to slow down as your skin becomes, your skin starts to dry out, your sebaceous glands become less active. So between your teens and your 30s, expect to have acne. what happens as you get older, you'll learn as we go through anatomy and physiology. Nothing good comes of aging. I think we just fall apart. So as we get older, our skin bears the brunt of that. We have a lot of environmental assaults to our skin. We've been exposed to a lot of sunlight and different things that we've been exposed to. And so as you get older, these effects start to accumulate. And so in your 40s and 50s, you're going to start to see wrinkling. You're going to start to see dry skin, scaling, maybe some dermatitis. Your skin doesn't rebound like it used to, maybe it becomes itchy. You'll see that the epidermis doesn't replace as quickly as it did. It starts to become thin. You may have noticed on your grandmother, you can see the vessels in her skin. The skin thins out. There's less fat. There's less adipose. The hypodermis thins out. You can see the vessels in the skin. The skin may become dry and itchy. You lose elasticity in your skin. You start to lose elastin and collagen in your skin, and so that means you're going to start to have wrinkles. As you're losing that fat, that's one of the reasons you kind of get cold all the time. You don't have that nice fat layer to keep you warm. Smoking is interesting because one of the things, smoking destroys collagen and elastin, especially around the mouth. So if you ever look at a smoker's mouth, you'll see those little fine lines just around the mouth. So a lot of times you can tell someone smokes just by looking at their mouth because of that collagen and elastin damage causing that little fine wrinkling around their mouth. You have an increased risk of cancer as you get older because as you get older, your melanocyte numbers start to go down and some of your dendritic cells, which help to keep your skin healthy. As your melanocytes start to go down, you don't have as much melanin shading over your DNA. So it's more likely to be affected by UV radiation and you'll get skin cancer. I threw these in, some other things that you've probably heard about, skin disorders. We have eczema, and this is an itchy skin rash. Many times it's an allergy, okay? So you see a lot in children. You got to figure out what they're allergic to, but once you do, either anti-allergy, some kind of medication or injection so they don't react to it anymore, and hopefully the eczema will go away. Not always, but sometimes you outgrow it or sometimes you're able to control it by figuring out what you're allergic to. Impetigo. A lot of times people say infantigo, but that's not right. It's impetigo. And this is a staphylococcus infection, okay? You just treat it with antibiotics, and so you're going to see little pink-filled lesions around the mouth and nose. It's real contagious. You see it in children, so you can go through a daycare in just a matter of days. You'll see it sometimes, people with mosquito bites. They'll scratch the mosquito bites. They'll open up the wound, and if you open up the skin, that allows bacteria to get in. So sometimes you'll see impetigo as a result of a really bad case of mosquito bites where you've itched them and scratched them and opened it up and allowed bacteria to get in there. We have staphylococcus. That's one of our normal bacteria, but if it gets into our skin and can get overgrown, then you can wind up with this little localized infection. Psoriasis, don't say the P, psoriasis. That's an autoimmune disease, and it's going to be these raised red patches. They're going to be cracked. They can itch and bleed and burn, and they can scar. So psoriasis left untreated can be very disfiguring, and you usually treat it with cortisone. Remember, autoimmune means your body is attacking itself. Okay, so for some reason your body has turned against you and is now attacking your skin. So that's psoriasis, and that's, again, very painful. It can be very disfiguring. Another autoimmune disease is vitiligo. Michael Jackson had vitiligo. That's how most people have heard of it before. And this means your own body has attacked itself. In this case, you've attacked your melanocytes. So you're getting rid of melanocytes. You have these large areas of unpigmented skin. So it's really obvious in people of African American descent when they have vitiligo because they'll have these large white patches. People of Caucasian descent, a lot of times they can kind of disguise it by they quit tanning, they stay out of the sun, so their skin's naturally white, so those patches don't show up as much. So again, the darker your skin is naturally, the more obvious it will be if you have vitiligo. But because you don't have melanocytes anymore, you have these large patches of unpigmented skin, it increases your risk for skin cancer. So people with vitiligo need to keep their skin covered to protect their skin from becoming cancerous. There's several different treatments, but nothing tried and true quite yet. A lot of things are being investigated. All right, that's all I've got, and I will see you in our next video. Thank you for your attention.